All right, let's dive into the fascinating world of influenza viruses and explore the various strains, their differences, and how they contribute to the severity of the illness. You might have heard about the terms flu season and flu shot, but did you know that the influenza virus is much more complex than just a single entity, causing severe colds? Influenza viruses are classified into four main types: A, E, C, and D. Influenza A and B are the ones responsible for the seasonal flu epidemics that affect humans. Influenza C is less common and typically causes mild respiratory symptoms, while influenza D doesn't affect humans at all, primarily infecting cattle. Now let's focus on influenza A and B. Influenza A viruses are further divided into subtypes based on two surface proteins, hemagglutinin, H, and neuraminidase, N. There are 18 different H subtypes and 11 different N subtypes, leading to a myriad of potential combinations. However, only two of these subtypes, H1N1 and H3N2, commonly circulate among humans. Influenza B viruses, on the other hand, are not categorized into subtypes, but are divided into two lineages, Victoria and Yamagata. Both lineages can circulate simultaneously during flu season and cause infections in humans. The severity of the illness caused by these various strains of influenza can vary significantly. While some strains might result in mild symptoms, others can lead to severe complications, hospitalization, or even death. This difference in severity can be attributed to factors such as the specific strain's ability to evade the immune system, the level of pre-existing immunity in the population, and the overall health of the affected individual. Additionally, influenza viruses are known for their ability to mutate rapidly, which can lead to the emergence of new strains that our immune systems are not well equipped to fight. This constant evolution of the virus is one of the reasons why we experience flu seasons and need updated vaccinations every year. So, understanding the various strains of the influenza virus and their differences is crucial in developing effective vaccines and treatments to combat this ever-evolving threat to our health. Now that we've discussed the various strains of influenza virus, let's explore why influenza tends to cause more severe symptoms than the common cold. You might be wondering why the flu can make you feel so much worse than just a regular cold. And there are a few reasons for this. First, let's establish that the common cold and influenza are caused by different viruses. While the common cold can be caused by over 200 types of viruses, including rhinoviruses and coronaviruses, the flu is specifically caused by the influenza virus, as we discussed earlier. One of the main reasons influenza causes more severe symptoms is due to its impact on the respiratory system. The flu virus can infect cells deep within the lungs, causing inflammation and damage to the respiratory tract. This can lead to symptoms such as chest pain, difficulty breathing, and a persistent cough. In contrast, the common cold tends to be limited to the upper respiratory tract, causing milder symptoms like a runny nose and sore throat. Another reason for the increased severity of flu symptoms is the potential for complications. While most people recover from the flu within a week or two, some individuals may develop serious complications such as pneumonia, bronchitis, or even organ failure. These complications can be life-threatening, especially for vulnerable populations like young children, the elderly, and people with weakened immune systems. The influenza virus can also cause a more intense immune response compared to the common cold. This heightened immune reaction can contribute to the severity of flu symptoms, including high fever, body aches, and fatigue. While the immune response is essential in fighting off the infection, it can also make you feel pretty miserable. So in summary, the reasons behind influenza causing more severe symptoms than the common cold include its impact on the respiratory system, the potential for complications, and the body's heightened immune response to the infection. It's crucial to recognize these differences and take the necessary precautions to protect yourself and others from the flu. Moving on, let's discuss the importance of vaccination in preventing the spread of influenza and reducing the severity of symptoms in infected individuals. You might have heard about the annual flu shot and wondered why it's so crucial to get vaccinated. Well, there are several good reasons for that. First and foremost, getting vaccinated helps protect not only yourself, but also those around you. The flu vaccine works by triggering your immune system to produce antibodies against the influenza virus, helping your body recognize and fight off the virus if you're exposed to it. This process, called herd immunity, can significantly reduce the spread of the flu virus in communities, particularly among vulnerable populations, such as young children, the elderly, and individuals with weakened immune systems. Secondly, the flu vaccine can help reduce the severity of symptoms if you do get infected. While the vaccine may not always prevent you from catching the flu entirely, studies have shown that vaccinated individuals who still get sick usually experience milder symptoms and a shorter duration of illness. This can be particularly important for people at high risk of complications from the flu, as it may help prevent hospitalizations and severe outcomes. Another benefit of vaccination is that it can help reduce the overall strain on healthcare systems during flu season by preventing widespread outbreaks and reducing the number of severe cases. Vaccination helps ensure that hospitals and healthcare providers can continue to provide essential care for all patients, not just those with the flu. Lastly, it's important to remember that the influenza virus is constantly evolving, as we mentioned earlier. This means that the vaccine needs to be updated each year to provide protection against the most recent strains of the virus. So, even if you've been vaccinated in the past, it's crucial to get your annual flu shot to stay protected. In summary, vaccination plays a vital role in preventing the spread of influenza, reducing the severity of symptoms in infected individuals, and protecting public health. By getting vaccinated, you're not only safeguarding yourself, but also contributing to the health and well-being of your community. As we've discussed, the influenza virus is continually evolving, which makes it a challenging target for vaccine development and treatment. With that in mind, let's examine the ongoing research and development of new vaccines and treatments to combat emerging strains and improve protection against influenza. One of the primary focuses of influenza research is the development of a universal flu vaccine. Such a vaccine would provide broad protection against various strains of the virus, eliminating the need for annual updates and offering more consistent immunity. Scientists are working on multiple approaches to develop a universal vaccine, including targeting parts of the virus that remain relatively constant across different strains, such as the virus's stem region. Another area of research involves the development of enhanced vaccines for specific populations, such as the elderly or those with weakened immune systems. These enhanced vaccines may contain higher doses of antigen, the viral protein that stimulates the immune response, or additional ingredients called adjuvants that boost the body's immune reaction. By providing stronger and more targeted immune responses, these enhanced vaccines aim to improve protection for those who may not respond as effectively to standard flu vaccines. Researchers are also working on alternative methods of vaccine delivery, such as nasal sprays or patches. These innovative delivery methods could potentially offer advantages over traditional injections, such as increased patient comfort and more efficient distribution during mass vaccination campaigns. In addition to vaccine development, scientists are continually exploring new antiviral treatments for influenza. Antiviral drugs can help reduce the severity and duration of flu symptoms if taken early in the course of the illness. Current antiviral medications work by inhibiting the virus's ability to replicate, but researchers are investigating other mechanisms to target the virus, such as inhibiting viral entry into host cells or disrupting the virus's ability. Ultimately, ongoing research and development in the field of influenza are essential for staying one step ahead of this ever-evolving virus. By developing new vaccines, treatments, and delivery methods, scientists aim to improve protection against the flu and reduce its impact on global health. Finally, let's discuss the global impact of influenza, its role in pandemics, and the importance of public health measures in controlling and preventing outbreaks. Influenza is far more than just a severe cold. It has significant consequences on a global scale, affecting millions of people each year. Every year, seasonal influenza epidemics result in an estimated 3 to 5 million cases of severe illness and approximately 290,000 to 650,000 respiratory-related deaths. These numbers highlight the substantial burden of the flu on individuals, communities, and healthcare systems worldwide. In addition to seasonal epidemics, influenza has the potential to cause pandemics. A pandemic occurs when a new strain of the virus emerges, to which the majority of the population has little or no immunity. This new strain can spread rapidly across countries and continents, causing severe illness and death on a much larger scale than seasonal epidemics. The most well-known example of an influenza pandemic is the 1918 Spanish flu, which is estimated to have infected 1/3 of the world's population and caused the deaths of approximately 50 million people. Public health measures play a crucial role in controlling and preventing influenza outbreaks. These measures can include vaccination campaigns, as we discussed earlier, to protect individuals and enhance herd immunity. Other strategies involve promoting respiratory hygiene, such as covering the mouth and nose when coughing or sneezing, and encouraging hand washing to reduce the spread of the virus. In the event of a pandemic, additional public health measures may be necessary to limit the spread of the virus. These could include travel restrictions, quarantines, and social distancing measures. Governments and healthcare organizations must also work together to ensure that antiviral medications and vaccines are distributed effectively to those most in need. In conclusion, the global impact of influenza is substantial, affecting millions of people each year and posing a constant threat of pandemics. Public health measures such as vaccination, respiratory hygiene, and global cooperation are essential in controlling and preventing outbreaks, ensuring that we can continue to protect ourselves and our communities from this potential